Good afternoon, everyone. My name is Philip Kaiser. I'm the local health authority for Galveston County Health District, and we wanted to have a press conference to update everyone on the progress of the investigation that's going on to the exposure of, potential exposure of patients to infectious agents at Coastal Health and Wellness Clinic. I think the news that most of you would be most interested in at this point is that yesterday afternoon there were administrative changes that were made at Coastal Health and Wellness. The executive director, Mary McClure, submitted her resignation to the Coastal Health and Wellness Board, and it was accepted. Similarly, the dental director submitted her resignation, and that was also accepted. The interim director for Coastal Health and Wellness is Kathy Barroso, and Ms. Barroso, as you know, is the director of the Galveston County Health District. This is actually what we anticipate to be a temporary appointment, but I think it was the general consensus of everyone involved that these changes needed to be made in order to move forward and to get to the point where they can resume seeing patients and serving this community. In terms of the testing that has been ongoing, as of last night, there were over 1,388 appointments that had been made either through the website or via telephone. 1,082 patients have been tested, and we have had results on 510 thus far, and thus far no one has become positive. Please bear in mind, however, that this is just a preliminary stage of the investigation. We don't have all the results, and we don't know where this is going to go, but we're very encouraged by the fact that we have not found any positive tests at this point. In addition, the results have been given to 111 individuals who have had their tests at this point, and we're in the process of working through that to make sure that people are informed. It is our goal to try and get the dental clinic up and running as soon as possible, and to that end we are working not only the Coastal Health and Wellness is not only working with the Galveston County Health District, but they are also working with a variety of state agencies as well to move forward, and we are confident that in fairly short order we will be able to announce the opening of the dental clinic. That's all I have to say at this point, and I'll be willing to take any questions. Yes?
Seeing as how some of these illnesses can be found years later, if they don't get tested, if they don't test positive for them now, for instance, say HIV and AIDS, is there still an opportunity or a chance that likely this could happen later for some of these people?
No, the good news is no. I mean, our technology has advanced tremendously. We can actually detect an HIV infection within 2 weeks of infection now, using fairly routine technology. Similarly with hepatitis C, with hepatitis B. So we're pretty confident that we are going to be able to identify people who may have been exposed during that 3-year period of time.
And then also, sorry, follow up on this. How many patients have had procedures? Say it was medical or dental, right?
Yes.
Within that 3-year
yes.
frame, how many patients do you think in total got seen for those procedures?
I don't have the number. I don't have the exact number off the top of my head, but it's about 9,600. Most of them are in the dental area, and by that I mean about 9,500 of them. But all patients with invasive procedures have been identified, and letters have been sent out to their house. In addition, we are also having press conferences like this, and the media attention helps bring attention to it. And our goal is to get as many people as possible to come in and get tested so we can reassure them, and then if we find anything, then we can refer them for treatment and do the right thing by them.
You talked about administrative changes from the top. What about people who were supposed to be sterilizing the equipment, so at that level, employees?
Right. So I think there were clearly systemic issues, and at the level of the people actually doing it, I think that what they suffered from was a lack of leadership and a lack of oversight. And we have been working with them. They have undergone tons of training Where we are right now is we are asking them not only have you been trained, but can you actually do what's called demonstrate competency, meaning that can you show to an independent observer that you can do it. And that process is ongoing right now, and once that's done, we think that they'll be ready to open up again.
So you don't anticipate any more positions being terminated or resignations at this point?
Just to keep the line straight, I know this is very confusing to people. We're the health district, and it's Coastal Health and Wellness. It's all of the people that have resigned did that through Coastal Health and Wellness. I was not there or part of that, so I can't give you any information about the details of that. With regard to any other personnel issues within Coastal Health and Wellness, obviously, like any agency, no one's going to tell you about the either potential disciplinary actions or other actions because of concerns for privacy for the employees.
You mentioned that Ms. Barroso is going to be staying on in an interim capacity. Is the health district going to be consulted on finding a permanent executive director?
Well, Kathy Barroso is the executive director of the health district, and she is going to take on the additional role of being executive director of Coastal Health and Wellness. Okay, and yes, we will be They have already asked us to help identify the type of person that would be a good person for the job of executive director.
How much oversight did you have over Coastal Health and Wellness?
Me?
Well,
none.
The district, not you personally, or involvement, shall we say?
Very, very little. So one of the breaches. So let's talk about each individual's role. So as the local health authority, basically I'm appointed by the county judge, and I have nobody works for me. It's very interesting. But under Texas law, I do have broad authority and powers in the event of an emergency. And so with this, I considered this a public health emergency. And I told Coastal Health and Wellness that there were certain things that I wanted done under my authority as local health authority. And they've been very cooperative with that. There has not been any issue with that. However, the Coastal Health and Wellness, because it gets federal grants, is required to follow federal law and procedures. And with that, the federal grants require that they have a separate governing board, and with that separate governing board have an executive director, which the federal government views as being the individual responsible for the functioning of the clinic. And the Galveston County Health District shares some services with them, meaning that I'm not sure exactly what, things like payroll and perhaps and some administrative things, but in terms of oversight and authority, there isn't any under the current structure. And we actually had some conversations with the federal government about that, and they made that very clear that this was the structure that they believe should be in place.
As far as the investigation with the originally 6, now looks more like 4 potential patients who contracted hepatitis C, possibly from the clinic, where are you on that investigation?
Right. Where we are in that investigation is we are working with the Department of State Health Services. They are reviewing our numbers and are actually looking at other databases to confirm things, to make sure that we haven't missed things. Remember, we're a county, and so they have access to a lot of other resources. We've also consulted with the Center for Disease Control. We have the testing is not only something to ease the minds of our patients, but it is also part of the investigation, because we want to know, as we test people, are there people out there that we did not know about that turn up positive? If they were positive, what were the associations, and is it something that we can potentially track back to the clinic, or is it something they possibly got somewhere else? So this whole investigation, quite frankly, is probably going to take months. And we're probably not going to have the answer to many of those questions for quite a long time.
You mentioned working with various state agencies. Can you elaborate which agencies exactly you work with?
So the agencies that we have been actively involved with are the State Department of State Health Services, Texas Department of State Health Services, otherwise known as DSHS. We have also consulted with the Centers for Disease Control. although it is our investigation, it is not a CDC investigation, and that's, I think, an important distinction to make from their point of view. We have also consulted with the grantor of the funding, the Health Services Resources Administration.
There were some patients who expressed concern that just because one test comes back negative, that they may have to be tested and retested for years to come just to make sure.
Right.
Is that a concern, a valid concern? Or
Not in the 21st century, not in 2018. So there was, as these tests were developed in the 1980s and 1990s, there were times when the testing was not very good, and where people would have to have multiple tests to ensure that that they were not infected with with HIV and hepatitis B. Hepatitis B, we can actually zero down very quickly as to whether this is acute infection or not. HIV, again, we can zero down very quickly to within 2 weeks of infection. Hepatitis C, the difficulty is not determining whether they are or are not infected. The difficulty more is detecting the age. So, for example, someone could come up positive with one of these tests and actually have been infected for 20 or 30 years. And we don't have a definitive way to say it was that period of time.
So will the clinic remain closed for now, reopen?
So
Acting executive director?
So the medical clinic has been open and has not stopped offering services, and we think that's very important for people to know. So for people who are being treated for blood pressure, for diabetes, for all the reasons that they would go to the doctor, there has never been any risk to them, and that continues to operate. The dental clinic in Texas City, we are anticipating will open up shortly, and we have some further administrative things to do before we're ready to do that.
Shortly means next week? Or
I don't think it's next week.
this one?
What do you have to say to patients who are concerned or scared to come back?
Yeah. Yeah, I would say that I understand that there's been a loss of trust. And if I were in that situation, I'd be extremely upset. I'd probably be very angry. But I would also ask them to look at the things that we're doing in the meantime. And I would ask them to allow us the opportunity to win back that trust. So we would like you to, I've heard stories people are afraid to come in and get tested, but please come in and get tested. You'll find that the testing mechanism is working extremely well. We are delighted with the efficiency at which we can get people in and out. We're delighted that we've only been doing this since Monday, and we're getting test results back to people already. If in the event that we have positive results, we're going to counsel patients if they want that counseling. So I think that things are moving forward. We recognize it's going to take time, but I think we've put both administrative changes in place to move us forward, and we are continuing not just with an investigation, but trying to reassure the public and anyone that's been affected.
Just want to make sure, you had said that no one has tested positive since Monday for any of these.
Not at this point, right.
But prior to this, was I hearing that there may have been 4 or? So
right. So what had happened? Just to review how the investigation was done and what it means, because I'm dealing with this every day, and I'm learning it takes people a while to wrap their head around this. And but what happened was when we found out about these lapses in sterilization, we asked the question was anybody harmed? Well, let's look and see whether there's any evidence that people were harmed. And the 3 infections we worry about in dental scenarios are HIV, hepatitis B, and hepatitis C. So we took their patient list and cross-matched it against the list of patients that we knew to be positive in Galveston County, because these are all reportable diseases. And what we found was that there was really no hepatitis B, there was really nothing with HIV, but there was a large portion of patients who were seen at the dental clinic who had hepatitis C. And the national average in terms of prevalence of hepatitis C is about 1.4%, but almost 4% of the patients at the dental clinic had hepatitis C. Now, that doesn't mean they got it there, but what it does mean is now you have a scenario where you have a high prevalence population and a lapse in sterile procedures. So the next question is, well, how many of these patients were diagnosed with hepatitis C before they had their dental visit, and how many after they had their dental visit? Of those people after the dental visit, it was a total of 6. We then went back and reviewed those cases, and what we found was that one of them was an individual who had lots of risk factors for hepatitis C, so probably didn't get it from the dental clinic. A second one was had a very, very low positive level test, and they didn't. And when we looked for what we call PCR, or genetic evidence of hepatitis C in their body, couldn't find it. So that's probably an old infection that's burned out. So that left us with 4 patients that we're concerned about. The next thing we asked was, did they cluster? Because we found that, we have 2 dental clinics, and what was really disturbing to me was that they all clustered at the Texas City clinic. All right, so they're all clustering, and not only that, they clustered around 2 doctors. And then the last thing we asked was there evidence that that someone who is known to have hepatitis C was seen at the same time or the same day, and in at least 2 of those patients, it was same doctor, same day.
With that cluster of time period, I know we have that 3-year
Right.
from February to March
Yes.
this year. What specifically is it cluster? Is it 1 month, like, say, in fall of 2016?
No, it doesn't cluster in terms of time. It's clustering in terms of place. Most of these, I think, I think all of those 4, Randy, correct me if I'm wrong, were either in 2015 or 2016. Is that right? Yeah, so there was a time period as well as association with place, as well as being seen after the clinic. So we are now, so it's with this, when we got to this point, we realized that we needed help in doing this investigation further, and that's when we consulted the Department of State Health Services and the CDC.
When was the red flag raised?
That's a really good question. I think that this is not something where, like a murder investigation, where you walk in and you see a corpse. All right, this is something more analogous to, oh, there's been an inspection. What's the problem with the inspection? Oh, they had findings around sterilization. Oh, they were almost all around sterilization. And then, is there any harm? Well, gee, that's a lot of people with hepatitis C, and then, it just keeps every step of the way. The other thing is, and things that I'm really not privy to tell you at this point, and then in talking to various people, we found other lapses as well. And so when you...
Still involving sterilization?
Around keeping instruments clean and sterilization, and also in oversight. And and this is nothing I haven't said before, and I'm not at liberty to say much more about it than that, but there was enough there that raised an alarm, and that we got to the point where we realized that the clinic had been closed a long time. There were inquiries, and so last week we decided that we needed to announce to the public and to allow people the opportunity to be tested.
When was the clinic closed?
The clinic was closed on February 12th.
Okay, as soon as this came out.
As soon as it came out, that afternoon. They have not seen a dental patient since then.
And the audit itself came out just prior to that?
No, that was the result of the audit. The auditors were so concerned that they informed us in person that day, and that day I made the decision that we were going to close the clinic that day, or close both clinics that day.
Can you speak to the specifics behind the equipment not being sterilized? What kind of picture can you paint for us?
What kind of picture? Well, it was a combination of issues. So first of all, there are administrative procedures, and these mean that every time someone operates a sterilizer, they need to write down that they operated a sterilizer, that they did it according to certain specifications, and unfortunately, that was not being done consistently. In addition, there was there were numerous sterilizers there. They weren't all the same one, and not all the staff knew how to properly operate all the equipment. And so that was a problem. In addition, the inspectors found things like dirty brushes that were used to clean equipment. There was a sonicator cleaner, which is a big tub that has cleaning solution in, and then it uses sound waves to clean off all the particles. There was no documentation that anyone was ever changing that fluid. They also found that that the water system used to operate the dental drills, you know how the dentist always sprays in your mouth and tells you to spit, that water is a closed system. It's supposed to be sterile. They put the water in every day. They're supposed to clean it periodically, drain it and clean it periodically. That, as far as we can tell, had been done since the clinic had been opened. In addition, they had not sent any test for to determine that there was no bacteria in the water. We sent the tests off, and we found out there was, in fact, bacteria in the water. We made them clean it again. And then there was still bacteria in water. Then we made them clean it again. And now there's actually been multiple tests that show that that water is clean. So it's a variety of things. It's not one simple thing. It's just a whole sort of nexus of offenses that really add up to one big problem.
Is there a possibility that the clinic could lose state and federal funding, and which agencies would make that determination?
Sure. The clinic receives most of its funding from, actually from the county. That it comes in a county allocation. We have been in contact with the county judge and also with various county commissioners, and they are very supportive of these efforts. I'm not going to speak for what our political leaders will do in the future, and I suspect they're waiting to see what happens with how this is fixed. The second agency is the Health Services Resources Administration, who they receive the second largest amount of money from. And that amount of money, and we have been in contact with them as well. I think their understanding of the situation, like other agencies, they have issued, conditions of continuing to receive the money. But in some ways, it doesn't bother me because all the conditions that they are asking us to fulfill, I want to see fulfilled as well. And so I think that that we are going to meet all of the requirements from them as well. So, is there going to be a reduction in funds? I have no idea. Are we going to proceed as though we're going to be able to fix this and get services back up and running? Yes. To us, this is very important because for many people, this is the only source of health care in the county, and we want to see this done right. We want to see them not only have health care, but have good quality health care that they and we can be proud of.
Can you estimate about how many patients the dental clinic was seeing every day?
I honestly don't know. Don't know the answer to that.
And just to clarify something, you were talking about the sonic cleaner, and it's a closed system, and you said you couldn't find documentation.
Right, so there are two systems. So there's a sonic cleaner, so that's where you take, something's gone into your mouth, and, you've had a cleaning and it's got blood on it. They dump it in there. That's one system that had fluid in it. We can't see that they weren't keeping records of ever changing that fluid. Okay. And then the second system is the system that runs the little water jets and the drill. And that was one that we can't see that had that the water had ever been drained. They've since fixed all that, but it was one of those things we looked at. We found problems and it just raised our concern. So that part I know for sure has been fixed. Any other questions?
So what do you think the bottom line to today is? There haven't been any positives from those you've tested.
Right. At this point, we don't know that anyone has been infected. We don't know that anyone has not been infected. At the end of the day, we may never know the answer to those questions. So what we have to do is we have to move forward, and we have to try and finish this investigation, inform anyone who may have been affected, and then do our best to restore services. So that's where we are. So thank you all very much. I appreciate it.
Excuse me, sir. I'm a resident of Galveston County.
Mm-hmm.
915. I'm a former patient
Uh-huh.
of the dental
Uh-huh.
clinic, and I have representing my family.
Mm-hmm.
Excuse me. I have some nieces and some cousins that have children that come here.
Uh-huh.
They're beautiful little children.
Yeah.
But yet, at the same fact, I got text after text on my phone asking what are the concerns of the health district and how they're going to be affected by it, and my little nieces,
Mm-hmm.
who are 14, 16, and one 13-year-old,
Mm-hmm.
and how they're going to be affected for the next 10 years. But at the same time, why hasn't there been any oversight regarding the opinion issue, and from a taxpayer standpoint,
Right.
I'm deeply concerned about the class action lawsuits and how that's going to
Right.
affect Galveston County taxpayers.
Right. So can I answer part of that? And what I would suggest is let's you and I talk afterwards about your nieces and about what we can do about them to make sure that they get taken care of. And then with regard to the oversight, I mean, I've stated very clearly this has been a failure in oversight. And insofar as anything we can do, we are doing everything we can to make sure that there is good oversight, and we are restoring good oversight. The second thing I would say is that as a taxpayer, I think you're asking really good questions, but I would also ask the taxpayers to consider what would happen if the clinic goes away, right? That would be a bigger disaster than what we're facing now. And that for poor people in Galveston County, there's really no other place to go. And I honestly can tell you, I feel this way. Kathy feels this way. I can tell you everyone working in the health districts who are putting in overtime and extra hours trying to address this, everybody wants this to work, and we want it to work well. We don't want it just to be a poor job and say they're poor people, they don't deserve good care. We want to give people the best care that they possibly can. Okay, thank you all very much.